Hi, I'm John Ray, founder of Haven Home Health and Hospice, and I'd like to tell you a little bit about the hospice program. Hospice kind of has a bad word sometimes for some people. They just think hospice means deathbed, and that's not what it means. Most people have the experience of they've known somebody in their past, a relative that's gone on hospice and passed away relatively quickly. Most folks, unfortunately, they get referred to hospice way too late. And so that happens oftentimes because of misinformation or misunderstanding about hospice. But hospice is supposed to be a 6-month program. There's more to it than just taking care of somebody as they're coming to the end of their life. It's also about supporting that family and making sure that we have the right equipment and medication in place, and making sure that we've done like a life history, and that we've given that person an opportunity for closure. For people who are like, I don't want to go through chemo again. I don't want to go through radiation again. I don't want to go through having to go to the hospital and have all these tests done. I just want to live my life. That's what hospice is for. It's for people who are like, I want to focus on the quality of my life and live a better life on the days that I have remaining. And that's what Haven's all about. We're about just walking with you, meeting you where you're at, and you're in the driver's seat. There are so many things that we provide. We provide a nurse, a chaplain, a social worker, an aide, medical equipment, hospital bed, oxygen, all kinds of different support equipment. We also provide hospice-related medications. When people go into hospice, there's this acceptance stage that you're trying to get to at some point, and it takes longer than a couple of weeks. That's why it's a 6-month program. And the program actually continues beyond 6 months. When somebody passes away, it actually lasts 13 months longer, because we actually do what's called bereavement care beyond that, because there's so much support that that family still needs. The problem is that people have just seen components of hospice, but they don't understand the bigger picture of hospice. And so, don't get me wrong, some people had some amazing experiences with it, but there are a lot that haven't, unfortunately. And what we want to do is make sure that we're bringing that full 6-month program to our people. We're just locally owned here, so it's really vital to us that those final days with someone, it's really important we get it right. We only got one shot at it. And so we want to make sure that the people who are in our community, and we live right here in Springfield, our reputation is really important. We want that all of our employees would send their family to us, because we're going to provide the best care for them.